How do you approach patient-centered care, especially in a sensitive area like obstetrics and gynecology?
Patient-centered care is at the heart of my nursing practice, particularly in obstetrics and gynecology, where patients often face vulnerable and sensitive situations. I approach this by first establishing a strong foundation of trust and empathy. For me, every patient is unique, and understanding their specific needs, preferences, and cultural backgrounds is essential. I prioritize active listening, ensuring patients feel heard and respected while encouraging open communication. This helps create an environment where they feel comfortable sharing their concerns. In obstetrics and gynecology, emotional and psychological support is just as important as physical care. I aim to provide holistic care by addressing both aspects. For example, during prenatal visits, I engage patients in discussions about their expectations and concerns regarding pregnancy and childbirth, empowering them with information to make informed decisions. I also advocate for their preferences during labor and delivery, ensuring they feel involved in their care. For patients dealing with gynecological issues, I take extra steps to create a private and non-judgmental atmosphere. I approach difficult conversations with sensitivity, explaining procedures and treatments in simple, reassuring terms to alleviate anxiety. When needed, I collaborate with interdisciplinary teams, such as social workers or counselors, to address broader psychosocial aspects of care. Ultimately, my goal is to ensure every patient feels valued and supported throughout their journey, fostering a sense of dignity and partnership. By combining clinical expertise with compassionate communication, I strive to deliver care that truly revolves around the patient and their well-being.
Describe a challenging ethical dilemma you faced in your nursing career. How did you handle it?
One challenging ethical dilemma I faced in my nursing career involved a terminally ill patient who had expressed a wish to discontinue aggressive treatment, but whose family insisted on continuing all possible interventions. The patient was mentally competent and had made their wishes clear to me during a private conversation. However, their family, driven by hope and fear of loss, strongly advocated for interventions that the patient felt were unnecessary and burdensome. In handling this situation, I relied on ethical principles like respect for autonomy, beneficence, and non-maleficence. First, I ensured that the patient's wishes were thoroughly documented and that their understanding of their condition and prognosis was clear. I carefully balanced advocacy for the patient with sensitivity toward the family's emotions, recognizing that their actions stemmed from a place of love and concern. I facilitated a family meeting with the medical team to provide clear, compassionate communication about the patient's condition and prognosis. During this discussion, I emphasized the patient's right to make decisions about their care while encouraging the family to share their feelings and fears. This helped foster a collaborative dialogue rather than conflict. I also arranged for a palliative care specialist to join the conversation, providing expert insight into the benefits of comfort-focused care and helping the family understand that respecting the patient's autonomy was not equivalent to giving up. Ultimately, the family agreed to honor the patient's wishes, allowing them to spend their remaining days in comfort and dignity. This experience reinforced the importance of clear communication, empathy, and advocating for the patient while considering the emotional needs of their loved ones. It also highlighted the value of interdisciplinary teamwork in navigating complex ethical dilemmas in nursing.
How would you manage a patient experiencing severe preeclampsia?
Managing a patient with severe preeclampsia requires prompt and comprehensive intervention to protect both the mother and the fetus, as it is a potentially life-threatening condition. My approach combines clinical vigilance, effective communication, and interdisciplinary collaboration to ensure optimal outcomes. The first step is to stabilize the patient. I would closely monitor vital signs, particularly blood pressure, as well as signs of worsening conditions such as severe headaches, vision changes, epigastric pain, or decreased urine output. I would administer antihypertensive medications as prescribed to manage blood pressure and prevent complications like stroke. Additionally, magnesium sulfate would be given to prevent seizures, following the established protocols and monitoring for any adverse effects such as respiratory depression or decreased reflexes. Fetal well-being is a critical focus in severe preeclampsia management. I would perform frequent fetal monitoring to assess heart rate patterns and ensure the fetus is not in distress. This includes working with the obstetrician and other team members to evaluate the need for early delivery, as delivery is often the definitive treatment for severe preeclampsia. If delivery is imminent, I would assist in preparing the patient for a cesarean section or induction of labor, providing emotional support and clear explanations throughout the process. Throughout care, I would maintain open and empathetic communication with the patient and their family, explaining the condition, treatment plan, and potential outcomes. Severe preeclampsia can be a frightening experience, so fostering trust and providing reassurance is essential. I would also work closely with other healthcare professionals, including obstetricians, neonatologists, and anesthesiologists, to ensure a coordinated and efficient response to the situation. By combining evidence-based interventions with compassionate care, my goal is to manage the acute crisis while minimizing risks to both mother and baby, ensuring the best possible outcome in this critical situation.
What are the key nursing interventions for a postpartum patient at risk for hemorrhage?
Caring for a postpartum patient at risk for hemorrhage requires swift, proactive nursing interventions to prevent complications and ensure patient safety. My approach focuses on ongoing assessment, prompt intervention, and interdisciplinary collaboration. The first critical step is vigilant monitoring. I would assess the patient frequently for signs of hemorrhage, such as excessive vaginal bleeding, uterine atony, or changes in vital signs, particularly tachycardia or hypotension. Palpating the fundus regularly is essential to ensure it is firm and midline, as uterine atony is the most common cause of postpartum hemorrhage. If the uterus is boggy, I would perform fundal massage immediately to stimulate contraction and minimize bleeding. Administering prescribed uterotonic medications like oxytocin, misoprostol, or carboprost is another key intervention. These medications help improve uterine tone and reduce bleeding. I would also maintain an accurate record of the patient's blood loss, using quantitative measurement methods to assess the severity of the hemorrhage and guide further management. Establishing fore access is crucial in these situations. If not already in place, I would ensure that the patient has at least one large bore fore line for fluid resuscitation or blood transfusion, if necessary. Administering intravenous fluids and ensuring cross-matched blood is readily available are essential to manage hypovolemia and stabilize the patient. Continuous communication with the healthcare team is vital. I would notify the obstetrician promptly about any signs of excessive bleeding or patient instability and collaborate with the team to address the underlying cause, whether uterine atony, retained placenta, or lacerations. If surgical intervention, such as uterine evacuation or repair, becomes necessary, I would assist in preparing the patient and supporting them emotionally throughout the process. Patient education is also an integral part of care. I would inform the patient about warning signs of hemorrhage, such as heavy bleeding, large clots, or dizziness, and emphasize the importance of seeking immediate help if these symptoms occur after discharge. By combining these interventions with compassionate support, my goal is to ensure the patient's safety while addressing physical and emotional needs during this critical period.
Describe your role during complicated labor and delivery, such as a cesarean section.
During complicated labor and delivery, such as a cesarean section, my role as a nurse is multifaceted, involving patient advocacy, clinical expertise, and effective teamwork to ensure the best outcomes for both mother and baby. Before the procedure, I play a crucial role in preparing the patient physically and emotionally. This includes confirming consent has been obtained, educating the patient about the procedure, and addressing any concerns to alleviate anxiety. I ensure the patient is properly positioned, the surgical area is prepped, and all required documentation is completed. Additionally, I establish access for fluids and medications and confirm that all necessary equipment, such as fetal monitors and emergency supplies, is readily available. During the cesarean section, I focus on providing continuous care and monitoring. I assist the surgical team by maintaining a sterile environment, anticipating their needs, and handing instruments as required. Monitoring the patient's vital signs and overall condition is a critical aspect of my role, as complications like bleeding, changes in blood pressure, or adverse reactions to anesthesia can arise. Simultaneously, I ensure fetal monitoring is in place until delivery, noting any signs of distress. Equally important is providing emotional support to the patient. I remain by their side, offering reassurance and clear explanations about what is happening. For awake patients under regional anesthesia, this personal connection is vital to keeping them calm and informed during what can be an overwhelming experience. After the delivery, I shift my focus to postpartum care. I assess the mother for signs of complications such as excessive bleeding or anesthesia-related side effects. I also ensure that the baby receives immediate care, facilitating skin-to-skin contact if possible and assisting with the initiation of breastfeeding. Additionally, I provide ongoing education to the patient, explaining what to expect during recovery and addressing any questions about newborn care. Throughout the process, I act as a vital link between the patient, their family, and the medical team, ensuring clear communication and seamless care delivery. My goal is to create a safe, supportive environment where clinical excellence and compassionate care come together to address the complexities of a cesarean birth.
What are the essential nursing interventions for a newborn experiencing respiratory distress?
Caring for a newborn experiencing respiratory distress requires immediate and carefully coordinated nursing interventions to ensure stabilization and prevent further complications. My approach combines prompt assessment, intervention, and collaboration with the medical team. The first and most critical step is thorough assessment. I would closely observe the newborn for signs of respiratory distress, such as tachypnea, nasal flaring, grunting, cyanosis, or intercostal retractions. Continuous monitoring of oxygen saturation levels and respiratory rate is essential to evaluate the severity of the condition and the effectiveness of interventions. To ensure the newborn receives adequate oxygenation, I would administer supplemental oxygen as prescribed, using an appropriate delivery method such as a nasal cannula or CPAP, continuous positive airway pressure, if needed. Positioning the baby to promote optimal respiratory effort is another key intervention, typically in a neutral, slightly elevated position to minimize airway obstruction. Maintaining a warm and neutral thermal environment is equally important, as cold stress can exacerbate respiratory distress. I would use an incubator or radiant warmer to stabilize the newborn's temperature, ensuring they remain warm while avoiding overheating. If respiratory distress persists or worsens, I would assist with advanced interventions such as intubation or mechanical ventilation, as directed by the neonatologist. During this time, I would ensure that all necessary equipment, such as suction devices and emergency supplies, is readily available. Additionally, I would monitor for underlying causes of respiratory distress, such as infection, prematurity, or meconium aspiration. Blood tests, chest X-rays, or other diagnostic procedures might be necessary, and I would work closely with the healthcare team to provide the appropriate support for these evaluations. Throughout the process, communication with the parents is vital. I would provide clear, compassionate updates, explaining the newborn's condition and the interventions being undertaken to ease their concerns. Parents often feel helpless in these situations, and offering emotional support and involving them in the care process, when appropriate, helps foster trust and reduces anxiety. By integrating timely clinical interventions with effective communication and teamwork, I aim to stabilize the newborn and create the best possible foundation for their recovery and health.
How would you prepare a patient for a gynecological procedure, such as a colposcopy?
Preparing a patient for a gynecological procedure like a colposcopy involves ensuring both physical readiness and emotional comfort. My approach is centered on clear communication, patient education, and attention to detail to create a supportive environment while addressing the clinical requirements of the procedure. To begin, I would provide a thorough explanation of the procedure. Many patients feel anxious about colposcopies, so I would describe what the procedure involves, its purpose, such as investigating abnormal Pap smear results, and what to expect during and after. This helps to reduce fear and build trust. I would encourage the patient to ask questions, addressing their concerns with empathy and providing reassurance. Before the procedure, I would review the patient's medical history and confirm that any necessary pre-procedure instructions, such as avoiding sexual activity, tampon use, or douching for 24 to 48 hours prior, have been followed. If any contraindications or unresolved questions arise, I would communicate these with the healthcare provider. On the day of the procedure, I would ensure the patient's physical comfort. This includes guiding them to empty their bladder for convenience and providing a private, calm space to change into a gown. I would position the patient comfortably on the examination table and explain the steps of the procedure as it progresses to maintain their sense of control. Throughout, I would offer emotional support, recognizing that the intimate nature of gynecological procedures can feel invasive or uncomfortable. I would reassure the patient, monitor their body language for signs of distress, and use calming communication to help them relax. After the procedure, I would provide clear post-procedure instructions, such as avoiding heavy lifting or sexual activity for a short period if recommended by the physician. I would also inform them about normal aftereffects, such as light spotting or mild cramping, and advise them on when to seek medical attention for unusual symptoms like heavy bleeding or severe pain. Ensuring they know how and when they will receive their results is also a priority. By combining compassionate care with thorough preparation and patient education, my goal is to make the experience as smooth and stress-free as possible while ensuring the patient feels informed and supported.
What advice would you give to a menopausal patient experiencing hot flashes and night sweats?
When advising a menopausal patient experiencing hot flashes and night sweats, I focus on providing practical strategies, lifestyle modifications, and evidence-based options to help them manage their symptoms effectively. My approach is empathetic and tailored to the patient's individual needs, ensuring they feel supported during this transitional stage of life. First, I would reassure the patient that these symptoms are common and often manageable. I would explain the physiological changes occurring during menopause, such as fluctuating estrogen levels, which contribute to hot flashes and night sweats. This understanding helps normalize their experience and empowers them to take control of their symptoms. For immediate relief, I would recommend simple strategies such as dressing in lightweight, breathable fabrics and using layers they can remove easily. Keeping their sleeping environment cool, such as by using a fan, air conditioning, or cooling pillows, can help reduce the discomfort of night sweats. I would also suggest avoiding known triggers like spicy foods, caffeine, alcohol, and hot beverages, which may exacerbate symptoms. Lifestyle modifications can significantly improve symptom management. Regular physical activity, such as walking, yoga, or swimming, has been shown to help regulate body temperature and improve overall well-being. Stress management techniques, such as deep breathing exercises, meditation, or mindfulness practices, can also reduce the intensity of hot flashes, as stress can be a contributing factor. If lifestyle changes are not enough, I would discuss treatment options in collaboration with their healthcare provider. Hormone replacement therapy, HRT, is an effective treatment for severe symptoms, but it may not be suitable for everyone. Non-hormonal medications, such as certain antidepressants or gabapentin, may also help. I would encourage the patient to discuss these options with their doctor to determine the best course of action based on their medical history and preferences. Finally, I would recommend staying hydrated and maintaining a balanced diet rich in phytoestrogens, such as soy, flax seeds, and legumes, which may have a mild estrogen-like effect. Ensuring adequate calcium and vitamin D intake is also important for bone health during menopause. By providing a combination of practical tips, lifestyle advice, and guidance on medical options, my goal is to help the patient feel more comfortable and in control of their menopausal symptoms, fostering a sense of confidence and well-being during this life stage.
How do you counsel patients about family planning options and sexually transmitted infections?
Counseling patients about family planning options and sexually transmitted infections, STIs, involves providing accurate, evidence-based information in a supportive and non-judgmental manner. My approach emphasizes patient education, tailored recommendations, and empowering individuals to make informed decisions that align with their health goals, values, and circumstances. When discussing family planning, I begin by exploring the patient's preferences and needs, such as their reproductive goals, lifestyle, and medical history. I provide a comprehensive overview of available contraceptive methods, including hormonal options like birth control pills, patches, and injections, long-acting reversible contraceptives, LARCs, such as intrauterine devices, IUDs, and implants, barrier methods like condoms, natural family planning techniques, and permanent solutions like sterilization. I explain the benefits, effectiveness rates, potential side effects, and limitations of each method to ensure they have a clear understanding. If the patient has specific concerns, such as managing menstrual irregularities or avoiding hormonal options, I tailor my recommendations accordingly. For sexually transmitted infections, I emphasize the importance of prevention, testing, and treatment. I educate patients about common STIs, their symptoms, and how they are transmitted. I highlight the role of condoms as the only contraceptive method that also protects against most STIs, encouraging consistent and correct use. If the patient is at high risk for STIs, I discuss additional preventive measures, such as pre-exposure prophylaxis, PrEP, for HIV or regular screenings. Confidentiality is crucial during these discussions, as sensitive topics like sexual health can make patients feel vulnerable. I create a safe, judgment-free space for them to ask questions and share concerns openly. For adolescents or younger patients, I ensure they understand their rights to confidential care in accordance with local regulations. If the patient is sexually active, I encourage regular STI testing as part of routine healthcare, even if they are asymptomatic, and I explain how early detection and treatment can prevent complications and reduce transmission. If an infection is diagnosed, I provide guidance on treatment options and emphasize the importance of notifying and treating partners to prevent reinfection. Throughout the counseling process, I empower the patient to take ownership of their reproductive and sexual health. My goal is to equip them with the knowledge and resources needed to make decisions that prioritize their well-being, fostering a trusting and supportive relationship that encourages ongoing communication about these critical aspects of health.
Describe your experience in handling obstetric emergencies, such as shoulder dystocia or postpartum hemorrhage.
Handling obstetric emergencies such as shoulder dystocia or postpartum hemorrhage requires a combination of clinical expertise, calm decision-making, and effective teamwork. My experience in managing these critical situations has taught me the importance of swift assessment, evidence-based interventions, and clear communication to ensure the safety of both the mother and baby. In the case of shoulder dystocia, my primary focus is on assisting the obstetrician and supporting the patient during this high-risk delivery. When shoulder dystocia is identified, I immediately alert the team and prepare the patient for specific maneuvers, such as McRoberts position or suprapubic pressure, which I perform under the provider's guidance. My role involves monitoring the baby's heart rate closely, as prolonged delivery can lead to fetal distress. I also maintain a calm and reassuring demeanor to reduce the patient's anxiety, explaining what is happening and providing support throughout the process. After delivery, I ensure the baby is promptly assessed for any signs of injury, such as brachial plexus damage, and that the mother is monitored for potential complications like excessive bleeding or perineal trauma. In managing postpartum hemorrhage, PPH, I prioritize rapid intervention to control bleeding and stabilize the patient. My first step is assessing the patient's condition, including vital signs, uterine tone, and estimated blood loss. If uterine atony is identified as the cause, I initiate fundal massage immediately while administering prescribed uterotonic medications like oxytocin or misoprostol. I prepare for further interventions, such as the use of a Bacri balloon or surgical procedures, by ensuring the availability of emergency supplies and notifying the obstetrician and anesthesia team. Establishing and maintaining access for fluid resuscitation and blood transfusion, if necessary, is another critical responsibility. Throughout the emergency, I monitor the patient's response to interventions and provide clear documentation for the medical team. What sets these experiences apart is the need for seamless collaboration. In both scenarios, I actively participate in team efforts, coordinating with obstetricians, anesthesiologists, and support staff to ensure a synchronized response. Simultaneously, I prioritize emotional support for the patient and family, recognizing the fear and uncertainty that often accompany such emergencies. These experiences have deepened my understanding of the critical balance between technical proficiency, quick thinking, and compassionate care in obstetric emergencies. My ability to stay focused and communicate effectively has consistently contributed to positive outcomes, reinforcing my commitment to delivering safe, high-quality care in even the most challenging situations.